Hello, I'm Dr. Anuradha, fertility specialist from Anutesti Baby Center, Hyderabad. Today, we as a team want to present some salient features of polycystic ovarian disease and its impact on fertility. Polycystic ovarian disease, which is also called as PCOD by many, is a very common hormone problem or a disorder which affects women of reproductive age group and is also one of the leading cause of female infertility. In this disorder, the cycles could be irregular or abnormal, and also there is an overproduction of male hormones. When an ultrasound scan is done, the ovaries show numerous small fluid-filled cystic spaces, also called as ovarian cysts. And because of this, there may be irregularity in the egg development and also egg release. Women with polycystic ovarian disease seek help from healthcare professionals to resolve different kinds of issues like hair growth, obesity, infertility. Women with polycystic ovarian disease also has a higher risk of abnormalities or disorders later in their life like heart disease, diabetes, uterine cancer. Clinical presentation of polycystic ovarian disease is highly different and is influenced by genetic makeup, environmental factors, and also lifestyle. Nearly 10% of women, that is 1 in 10 women of childbearing age group, suffer from polycystic ovarian disease. And 70 to 80% of the times, the ovulation disorders are caused by PCOD. And more women with PCOD are turning towards treatments like IVF and so on. Though it is such a common problem, it is also one of the most underdiagnosed disease in the world. And less than 25% of women with PCOD are in fact diagnosed. And sometimes few normal women are also overdiagnosed as having PCOD. PCOD is considered as a condition having an impact on women's health worldwide and can affect every stage of their life cycle. To help spread the word about polycystic ovarian disease, this month, September, is dedicated to raising awareness and is regarded as PCOS Awareness Month. So, in support of PCOS Awareness Month, we all have come forward to provide some information on PCOD and its related fertility treatments. Now, Dr. Sophia will explain why and what of PCOD.
What is a PCO? PCO is a condition in which there is increase in male hormones or the androgens. What happens in the PCO? When there is increase in male hormones, there is male pattern type of baldness, oily skin, pimples, acne, irregular cycles. So, what did I do to get a PCO? If your mother, your sister or your aunt have had a PCO, there are more chances or you're more likely to have a PCO. Other than that, environmental factors, stress and lifestyle play a major role. Lifestyle in the sense if there is sedentary life, more of junk food, sugary drinks might make you have a PCO. So is PCO only a concern to the lean? No. To the overweight? No. There is something called a lean PCO in which patients who are not overweight also show all the signs of a PCO like irregular cycles and ultrasound changes and all. So is PCO, what happens actually in a PCO? In a PCO there is increase in male hormones like I have already mentioned. Along with that there is insulin release, like insulin hormone is released, and then insulin resistance. There's more of insulin and then insulin resistance, because of which there is anovulatory cycles or eggs do not form in an ovulatory cycle. Anovulatory cycles become an anovulatory cycles and which leads to an infertility. So does PCO go away with menopause? Well, in patients who have a PCO, the menopause gets delayed about a year or two in a patient in women with PCO compared to women who have not had a PCO. So what is the criteria? How do I know that I have a PCO? If you have any of the two symptoms that I am going to say now amongst the three, then you are a PCO. That is increase in male hormones or the androgens, changes in the ultrasound changes of a PCO, and irregular cycles. If you have any two, that means you are a PCO. Then what are the effects of PCO on pregnancy? A woman who has had a PCO and got pregnant, she might have more chances to have miscarriages and abortions compared to chances of her getting high BP and high sugars in pregnancy is more likely. Another thing, such patients end up into cesarean sections. The rate of cesarean sections in PCO is more compared to patients who are not a PCO. What is the effect of PCO on general health? Women who have a PCO have more chances to have high BP, high sugar levels, to get pre-diabetic or diabetic, and decrease in good cholesterol, that is HDL, and increase in bad cholesterol, that is LDL. Women with PCO have more chances of having an endometrial carcinoma in later stages of their life. So what are the tests that we do to know that we have a PCO? The test is LH, that is luteinizing hormone, FSH, that is follicle stimulating hormone, and then serum prolactin, thyroid stimulating hormone, that is PSH, and then definitely the ultrasound. So we, even having said that PCO has so many problems, the condition can get better with good treatment and medication. So do not get disappointed and approach your doctor for further advice.
Now about the tests and diagnosis of PCO. How to know about the diagnosis of PCO? There is no specific single blood test to diagnose PCO. It is an imbalance of hormones. The tests usually done are testosterone, FSH, LH, thyroid and prolactin. Sometimes PCO is associated with imbalance of thyroid and prolactin hormones. The criteria to diagnose PCO. The first one is irregular cycles. The second one is to assess clinically and through blood tests. The third one is the last but not the least is ultrasound findings in PCO. Findings in ovaries. Out of above three criteria, any two can be considered to diagnose PCO. Apart from the blood test, most important diagnostic test is ultrasound findings. What are the ultrasound findings? Dr. Madhusri will discuss regarding ultrasound findings.
So once the patient goes to a clinician and clinically the gynecologist suspects it to be a PCOS, the first thing the gynecologist does is refer the patient for an ultrasound scan. So ultrasound scan is done in two ways, transabdominal and transvaginal. Transabdominal with distended bladder and transvaginal is an internal scan after the bladder gets empty. So we usually prefer advocating two methods because few cases of PCO have adrenal growths as the cause for PCOS. So we usually do a transabdominal followed by a transvaginal. So what do you find on a scan in a patient with PCOS? There are basically 3 to 4 features, ultrasound features of PCOS. The first and foremost thing is the ovary appears enlarged, almost up to 3.5 centimeters in length, and the volume is maximum up to 10 cc, is usually up to 10 cc. And then the number of follicles, as you see in these two pictures, the black round structures which you are seeing in these two images are nothing but the follicles. And these follicles, if they are more than 20 in one ovary, the follicular number per ovary, FNPO, on a high resolution scan, even in one ovary, if this picture is seen, it is still considered as one of the feature of PCOS. So there are basically two patterns on ultrasound. As you see in these two pictures, in the first pattern you are seeing these follicles arranged peripherally, whereas you are seeing the stroma bright and echogenic in the center. This is the peripheral cystic pattern appearance of PCOS on the ultrasound. Whereas you come to the next picture, the whole ovary gets studded with these follicles throughout. This is the generalized cystic pattern. Sometimes this generalized cystic pattern is also seen in another condition which is called multicystic ovaries, which might be due to hormonal imbalance in thyroid and prolactin. So for a diagnosis of PCOS, it's just not sufficient to see a picture of PCOS on the scan. It is very important to correlate with clinical and biochemical tests, because 20% of the patients, even with normal clinical features, with no clinical symptoms and normal blood test, have a PCO appearance on the scan. So it is imperative that it should be correlated. The ultrasound picture should be correlated with clinical symptoms and biochemical tests for a PCO to be diagnosed. And ideally, the scan should be done within the first 5 days. And that is the ideal time to do the scan. Thank you.
Hello, I'm Dr. Sridevi Reddy. I'm talking about lifestyle modification in PCOS. It is one of the most important modification changes which we need to bring in the PCOD. In this, both and physical activity is the more important. Right? Diet and physical activity should be the first line of therapy in PCOD. How do we bring changes in diet? Reduce fat foods, fatty foods, high fatty foods. Avoid taking junk foods, cool drinks, reduce carbohydrates, reduce coffee, tea and sugar intake, and eat small portion of meals frequently in 5 to 6 times a day. That decreases food cravings. So that ultimately reduces the weight. And plan for the early dinner. Try to complete the dinner before 8 p.m. The diet which should be taken is nuts, flax seeds, chia seeds and whole grain foods like jawari, ragi, oats, all those foods. The one which should be avoided is avoid alcohol, smoking and drugs. Now it comes to physical activity. It is very important in PCOS. So daily, what contains in physical activities? Swimming, walking, cycling, aerobic exercises, dancing, yoga, meditation also. How long we need to do the physical activity? At least 5 days a week. In PCO women, in obese PCO women, at least do 1.5 hours physical exercise per day till they loses the weight. Once they lose the weight, at least maintain doing 45 minutes a day throughout life. Even if you lose 5 to 10% of weight, it helps in natural ovulation, natural pregnancy chances. Many PCO women says it's very difficult to reduce the weight. If you follow all these diet, what we told, and physical activity, if you maintain lifelong, these kind of modifications in life, this will reduce to helps in your weight. Like this, small changes in life will give you big differences in life. Thank you.
In PCO, we have stepwise approach. In that, diet, lifestyle changes and exercise have key role. Along with that, we have some options of medical and surgical management. When it comes to medical treatment, first option is metformin prescribed in PCO. This medication is normally a diabetic drug given in diabetic patients. So people may ask, I don't have diabetes. Why should I use this? But the main reason for PCO is insulin resistance, and metformin can treat this, which also helps in improving pregnancy chances and for weight reduction also. Next step is simple medication which are used for the development of follicles. Commonly, we cannot see egg in the scan. We can see only a follicle which may have egg inside. Commonly used medications are clomiphene citrate, letroz and tamoxifen given from day 2 or day 3 for 5 days, and we do follicular monitoring, serial scans to check for the development of follicles, and trigger injection is given for rupture, and we advise them to try naturally. Usually we can try 5 to 6 cycles, and with this many patients may conceive with this simple ovulation induction drugs. Apart from tablets, there are also injections, gonadotropin hormonal injections, which helps in development of follicles and also in improving the quality of the egg. If there is no response, we can increase the dosage. So even after trying with these medication injections, still if there is no response in the development of follicles and ovulation, then we would suggest lab. What exactly is lab? How it is done? How it benefits in PCOS now will be explained by Dr. Pratibha.
In spite of using medical treatment for follicle development and release, if there is no response or if didn't conceive yet, then we suggest an option about laparoscopy. What we exactly do in laparoscopy? These polycystic ovaries are punctured at 4 to 5 sites, which helps in reduction of male hormones and thereby in the development of follicle in future. During the same procedure, the fallopian tubes can be checked and tubal patency can be assessed, and we can even look for any other gynecological problem during the same procedure. So, as we say about laparoscopy, some of the patients ask, "Ma'am, is it a 100% cure for PCOD?" We can't say 100%, but definitely 70% of the patients can be benefited, and more benefit is seen in the first 6 to 7 months. And lean PCOD patients are more benefited than the one with obesity. So, but there is a small side effect with laparoscopy. Normally we puncture at 4 to 5 sites on the ovary. But if we do more punctures on the ovary, there is chance of reduction in the ovarian reserve and later formation of adhesions. So having said all these, PCOD gets better with consistent treatment. So even after doing laparoscopy, if there is no response or if the patient didn't conceive, then we have further treatment options which would be elaborated.
Most of the PCO women have a chance to conceive by ovulation induction medication. In case they do not conceive with these drugs, we offer them the higher mode of treatments like IUI or IVF. IUI means intrauterine insemination. During the ovulation time, the husband's sample is processed in the lab, the good sperms are separated and they are introduced into the uterine cavity of the woman. Usually about 10 to 12% of the people conceive in the first cycle of IUI. If all factors are normal, by 3 to 5 cycles, 40% of the people can conceive. The problem in PCO patients is how they respond to the drugs. Some people respond very good with the drugs in the first cycle. When we use the same drugs in the next cycle, they may not respond in the way we expect. PCO patients may not get depressed or get disappointed because we have other options like increasing the dose of the medication, change the combination of the drug, or can also try with injections. 70% of the patients have a good response, but 30% of the patients can't expect how they might respond with these drugs. When we use injections, there is a chance of overstimulation, which is called as ovarian hyperstimulation. In this, the patient has enlarged ovaries, gets more number of follicles, and there is a risk of multiple pregnancy like twins or triplets or quadruplets. In such cases, we sometimes cancel the cycle and give medication to decrease the hyperstimulation. Or if there is a very good response, we convert the same cycle into an IVF cycle. In spite of all these treatments, if the patient do not conceive, in few people we try the other treatment modality called as DIPI. DIPI means direct intraperitoneal insemination. In this process, under ultrasound guidance, under anesthesia, during the ovulation time, the husband's sample is processed in the lab and is introduced into the pouch of Douglas. This is the place where after ovulation, the ovum is present. We usually try 1 to 2 cycles of DIPL. In spite of all these treatments, if the patient do not conceive, we opt for the higher treatment called as IVF, about which Dr. Madhushri is going to explain.
So, if IVF patients doesn't respond to IUIs, the last resort is the IVF. Honeycomb appearance, yeah. This is what we see in patients undergoing, in PCOS patients especially, undergoing IVF treatment. This is because of the injections given for stimulation in PCOS patients undergoing IVF. So all these follicles which are developed, as you see in the next picture, you can see a needle within the follicle, and these follicles are aspirated with the help of the needle inserted through the guide attached to the probe of the ultrasound machine, and the follicular fluid thus aspirated is sent to the lab for the presence of the egg. So the PCO patients develop so many follicles as you see from the picture. So the procedure for PCOS patients, the oocyte recovery procedure, takes a bit longer time than compared to other patients. Same time, there will be little bit of extra discomfort. But the positive thing is we get more number of eggs with resultant more number of embryos. So what about the side effects? Yeah, actually with changed protocols, many safety protocols have come, especially designated for PCOS patients. Hence the risk of hyperstimulation, which used to be there quite often, which we used to see quite often 3 to 4 years ago, has significantly come down. So it's almost less than 1% in the last 3-4 years. So in fact, PCOS patients undergoing IVF, actually it's a boon for them, because in case if they don't conceive in the first attempt, they have more number of frozen embryos with which they can try frozen embryo transfer without going through the complicated process of stimulation and the recovery procedure. So the challenges which the embryologists face in patients, in PCOS patients, particularly going through IVF, will be explained to you by Dr. Prasad.
Hello. Everybody may be thinking that in PCOS patient, the recovery procedure could be different, but it's not true. Whatever that we do in normal IVF procedure, same thing is carried in even in PCOS patients. But we expect more number of eggs. That's the reason one day prior to the recovery, we prepare more culture dishes for the sake of PCOS patients. Since there is an empty follicles, more empty follicles, during recovery, if we are not able to identify the egg in first flush, the flushing will be repeated once again. By doing this, it may take a little bit more time in the lab, but there is more hope that we can collect more number of eggs in PCOS patients. Till now, in Western women also, the recorded number of eggs that was collected is 50. Even in our clinic, in one patient of PCO, we have collected nearly 32 eggs. What are the eggs that we collect in these PCOS patients? There is little bit more percentage of immature eggs can be possible. All these eggs will be matured and fertilized through ICSI technique. ICSI means injection of a single sperm into the egg is called as ICSI. By following ICSI procedure, there is every possibility that we will increase the fertilization rate with which we can generate more number of embryos. The cleavage pattern after the fertilization is as good as same in what we see in normal IVF patients. Whatever the number of embryos that they are generated, keeping the number in mind, we will be freezing all the embryos, which can be useful for 3 to 4 cycle of a frozen IVF cycle. If patient is lucky enough to conceive in first IVF cycle, frozen cycle, the frozen embryos are ready for this patient for the second baby after a couple of years. The major hurdle in PCOS patients is, since there is a risk of hyperstimulation, they will not have any 100% fresh cycle transfers. From the lab side, what I can say, though we spend more time and more manpower, we'll try to generate more number of embryos where they can use it for 3 to 4 cycles, by which they can improve the PCOS patients who can improve their success rates. Finally, I can say not to worry in the PCOS patients. They can try and improve their pregnancy chances.
Many patients have lots of myths and doubts regarding PCO at the back of their mind. One such question is that if I have PCO, is my baby going to have any abnormality? Normally also, patient may develop diabetes during pregnancy. And if a patient with PCOD develops diabetes during pregnancy, baby has higher risk of developing abnormalities. So necessary steps are to be taken ahead if a patient has PCOD. Genetically also, there is 10 to 15% risk of transmission of mother's hormonal imbalance to the baby later in life. To reduce the risk, lifestyle changes, diet, exercise will help a lot. If PCOD gets controlled, risk also decreases. Some people ask that, can I get pregnant with PCOD? Absolutely yes. Compared to other problems, PCOD with treatment has more chances to conceive. Patient may conceive naturally also. Some people ask, will PCOD go away naturally on its own, and does it reduce after pregnancy? If a patient has PCOD, mainly lifestyle changes will help to reduce symptoms. As age advances, PCOD may reduce due to hormonal changes. And yes, it may reduce after pregnancy also. Some people ask that how do I know if my PCOS got cured? No tests are required to know whether PCOS cured. Manage your symptoms like irregular cycles with medication and mainly by diet and exercise, and also by doing things which make you happy. Let's see what is the takeaway message given by Dr. Anurag.
We can see that PCOS is a complex disorder for which there is no one treatment. Multiple treatment approaches are required, and it is based on the reason a patient seeks treatment. An accurate, timely, and early diagnosis is essential so as to prevent long-term health consequences, reduce associated symptoms, and also to improve chances of conception. It is very important to have support from family, friends, and husband to avoid any kind of psychological issues, as it can have an impact on the quality of life in relation to marriage, education, fertility, and self-esteem. Remember, acceptance is the key. It is a situation where one needs to learn to balance lives. Though there is no cure for PCOD, it can be controlled. Lifestyle changes can ease most of its symptoms. Rather than feeling guilty and blaming ourselves, one need to connect more with the bodies and in a more loving way and a positive way. It is important to know who we are at the core and just move forward. Do you know 20% of women with polycystic ovarian disease conceive naturally on their own without any kind of treatment? And also a woman with a PCOD has more chances of a conception as compared to other women with other kinds of problems in causing delay in conception. An advantage with the polycystic ovarian disease is that lot of eggs are available for treatment and they are available for a long period of time. A woman with PCO does not lose her eggs so fast. So as all this would improve chances of conception, just stay positive and just carry on. Thank you.